I'm your host, Shabi Lochanlal for Speak Your Mind, and welcome back on this show. So when you need health care, you have a choice between receiving care from a chiropractor versus receiving care from a medical doctor. We have both on our show today, but separately we'll be talking to a chiropractor in this session, and then we'll move on to talk to the medical professional. Nevertheless, the techniques can heal your pain very differently. So on my first two segments, I have with me Dr. Byron Cragun, and I know you're familiar with him because he has been on Speak Your Mind previously. Doctor, welcome on the show.
Hi, how are you?
I'm good. I think my back is better too after the treatment. So Dr. Cragun, we have talked about on Speak Your Mind, you've been on the show and we've talked about who is a chiropractor and chiropractic treatment. Now to take this program further, we're going to talk about what techniques do chiropractors use in treatment for our listeners and for our viewers. Would you like to enlighten us on that?
Yeah. Well, to cover that, I have to go in depth on some things so that you'd understand what a chiropractic treatment is. First, chiropractors are spinal specialists, they're nutritionists, they are the GPs of natural medicine. Everybody knows in science that if there's something wrong with the nervous system, the spine, you're going to have some problems somewhere. Some might not be so obvious, some might be really obvious. And chiropractors are also, since they're into nutrition, they're into, we call it cellular medicine. And cellular medicine is versus conventional medicine. Mm-hmm. Conventional medicine treats diseases at the organ level, symptomatically. They treat the symptoms with synthetic drugs. Cellular medicine treats the body at the cellular level. And it's at the cellular level that all diseases begin. And they begin because they have lack of essential nutrients, vitamins, minerals, amino acids, and other trace elements.
So, doctor, just to interrupt you there, when you talked about a chiropractor, the treatment they use, you do use medicines and chemicals more? Or?
No, we use all natural compounds, vitamins, minerals, and things like that. Phytobiologicals, you might call it, plant compounds. Mm-hmm. Okay. And these treat root cause. And this is what is necessary for the world of medicine to adapt cellular medicine and throw conventional medicine out the window or use it minimally because we're just treating symptoms. You want to treat the cause, we'll get into disease processes, cancer, heart disease, any of those diseases. When you look at them deeply, they are a deficiency of some micronutrient. Mm-hmm. And you have to understand that micronutrients, there's four things that make life: air, water, macronutrients, which are fats, carbohydrates, and sugars, and protein, and micronutrients.
So what you're trying to say is that chiropractic treatment is more natural treatment,
yes, just
right?
a comprehensive one.
So my next question would be...
I have to finish this one point, though.
Yeah.
This is an important point. Excuse me.
Yeah, go ahead.
When you lack air, one of the essential ingredients for life, you pass out. When you lack water, you get thirsty. Mm-hmm. When you lack food, you get hungry. But when you lack micronutrients, you don't have any symptoms until the disease happens, let's say 20 years ago, heart disease. And we know what causes heart disease. Absolutely, there's no question about it. But conventional medicine is still holding back and denying because they are controlled by the pharmaceutical investment business. They just run everything. Mm-hmm. Okay, there.
So my next question is, while talking about conventional medicine and the other medicine, our country has some good medical care, right? But sometimes a patient's need calls for a different type of therapy, like you're talking about. So why don't more medical doctors refer their patients to a chiropractor if they can help? Is it because of chiropractic is too expensive?
You couldn't ask a better question, and we'll address that completely. But you have to get into the history. Why? You ask why they don't. Well, this is vital. They all need to hear this. In the early 60s, the AMA had a campaign, and the judge read it in court. We will eliminate chiropractic from the face of the earth. Really, she said, from North America and the rest of the world. Well, how are they going to do that? The medical doctors were referring to chiropractors at the time. There's no problem. Interprofessional relations, that's how it's supposed to be. Well, the AMA didn't like that. They were trying to keep the medical doctors from associating with chiropractors, so they made a new ethics ruling. This is very serious. a new ethics ruling. The ethics ruling was this, that if you got caught associating with a cultist or an unscientific person, and they put chiropractic under the unscientific category, you lost your hospital privileges and your license, okay?
Mm-hmm.
Now, that went out to these guys were laughing at it, but the AMA was serious. And so here's what happened. They set a bunch of MDs up, sent somebody to the MD's office and said, tell me where a good chiropractor is, and they told them. And they were busted right there. They lost their license. This happened a lot of times until finally, very shortly, the whole world of medicine knew about this policy, and they said, well, there must be something to this chiropractic thing. Oh, they must be bad people, if the people are losing their licenses.
There's not much awareness on chiropractors in Fiji, and I think you were the only specialist here, Doctor. Yeah. Now, while preparing this talkback show, Speak Your Mind, I had posted some comments on Speak Your Mind Facebook page, and there's this Amal Sharma. He lives in Australia, and they can access to our Facebook. He is a registered nurse by profession in Brisbane, Australia. He made a comment on that page, which you can also cite after this program. He says that a chiropractor tries to resolve migraines and headaches, ends up giving you a herniated vertebral disc in the process. What do you have to say about this?
Well, that's total bull, okay? I'll tell you why. Listen, if you understand chiropractic, you couldn't say that. Remember, MDs were forced not to associate with chiropractors. That's exactly why they don't hear. They have a boycott on me in Nandi. Dr. Narayan told me they believe this crap that came out of the United States, and they're enforcing it, not to send anybody. But the headache issue is very important here.
Mm-hmm.
The reason I'm a chiropractor today and not a surgeon, okay, I was accepted into the USC School of Medical and Dental Surgery. I was going to be an oral surgeon. I had my acceptance there. But I couldn't go because I had migraine headaches. Mm-hmm. Migraine headaches, suicidal.
You suffered
from
that?
Oh, yeah. I had a serious injury 3 years previously, and they didn't know what to do with me. Serious neck, shoulder, back injury. And I was hospitalized. They gave me injections. My hand was numb. I couldn't sleep. My neck was painful. And gradually, I started developing headaches. And over the 2-year period, they got to be migraine headaches that were so severe, I couldn't study anymore. So I was going to have to give my position up at USC to die, because, I wouldn't live like that much longer. It was serious, throwing up, vomiting, hiding in the closet.
How did you get better, doctor?
Okay, somebody told me, why don't you go see this doctor? Well, I said, yeah. I went, and it turned out to be a chiropractic doctor. I didn't know what about chiropractic. I was pre-med. I was, top of my class, whatever. I was there, and I didn't even know. And this chiropractor examined me, x-rayed me, showed me stuff, and I'm going, wow, I'm impressed. And then he did a spinal manipulation on my top cervical vertebra, which he said were completely rotated. And I had this huge noise, and my neck went back into place, and I felt this rush of relaxation that was beyond imagination.
So your migraine was treated with chiropractic treatment.
And so for anybody that says something idiotic like spinal dissection of vertebral arteries or something like that, they come on, listen.
So you're trying to say that migraine and headaches can be treated with chiropractic treatment?
Absolutely. What am I saying? I'm a perfect example of a living subject.
So we'll take a break, doctor, and when we come back, we're going to talk about what is the chiropractic treatment for headache, migraines, which we did promote on our promo, and how does vitamin C benefit us? Soon after this break.
And I'm sure look into that.
Yeah, if you want to give us a call, please call and talk to Dr. Cragun if you have migraine, headaches, or if you have any questions related to chiropractic treatment. This is your time. This is Speak Your Mind. I'm your host, Shamilochan Lal, and I have a caller here on Speak Your Mind. Hi, hello, welcome on Speak Your Mind.
Bulavinaka Shamil, this is Guy Maxwell from Singatoka.
Yes, how can we help you? Doctor, would you like to put the headphone on? Yes?
I just wanted to say hi to Dr. Cragun. I was a patient of his in Mandy a lot of years ago, and he repositioned my spine and got rid of a lot of pain I was in with what was like arthritis and headaches.
So
And
how long were you suffering from this pain?
Oh, it developed over a period of years while I was living in Papua New Guinea and working,
Okay.
and I developed arthritis. And yes, it was a wonderful relief, and I'm also a firm believer in natural medicines and things as much as possible instead
you.
of taking tablets. So,
Thank you. Thank you very
yes,
much
I just
for
wanted to say welcome back to him, back on the air, and keep up the good work.
Thank you very much for your call. So if you want to take part on Speak Your Mind, do call us on 3220906 and 3220907. This is my last segment with Dr. Cragun before we move on to the next three segments with other medical practitioners. Now, doctor, you said that you had migraine and headaches, and then a chiropractor treated your head. There was some kind of a sound. So what is this popping sound when adjusting the bone or joint?
When bones go back into place, they obviously they hit one another. The joints do somewhat, but some of the noise comes from applying negative pressure to a fluid. And when you apply negative pressure, like the nitrogen in liquid form, it comes into bubble form. Like if you get the bends and rise too high out of the water, you get bubble formation. And
Doctor, would you be mind?
quickly
Yes,
goes
sir.
away.
Yes.
Quickly goes away. But on mine, it was pretty dramatic. I sat there for about 30 seconds and I couldn't believe what just happened, and I realized that I could be helped, and that changed my life. I said, man, I want to do it. Why wasn't I sent to you 3 years ago, he said. I asked the doctor, and he said, well, the other doctors don't believe my form of medicine. I'm going, God, I'm a pre-med student. I didn't even know about chiropractic.
So how can headaches and migraines, sinuses can be healed from chiropractic treatment? And I know there are some people who are so interested to know this very moment.
Well, you have to say, all the autonomic nervous system controls the blood flow to every organ. When you get up towards the skull, it becomes a very complex thing. You have circulation going through the bones. You have nerves controlling blood flow. You have, if you have a spinal misalignment, putting pressure on some of the autonomic nerves, you might have decreased blood flow in the sinus, which is going to always cause chronic sinus problems. So you can treat it with antihistamines. It'll go away for a while, but the core problem is spinal misalignment. When you clear that up, I do work on kids all the time, all day long. These little guys come in with years of sinus problems. They fell out of bed, hurt their neck. It's out of alignment. It's causing blood flow problems to the sinus. They have the problem. So I'll adjust them, realign the spine, and they'll turn to the mother and say, Mommy, I can breathe for the first time. And that maybe is the last time they have to see me. Adults are different. It takes more treatment.
So it does take more treatment. You have to go to a chiropractor for a number of times to be able to be treated from migraine and headaches.
This is not a migraine. The medical profession assumes that it's completely non-fixable. Well, how can they say that when I've just told them my experience? They can say, oh, you didn't have a migraine now because it got cured? Oh, you don't have cancer because you couldn't have cancer because you can't cure cancer.
So in this process, doctor, there is no medication or nothing involved when you do chiropractic treatment for migraine and headache?
A lot of chiropractors have physiotherapists in their office. They apply physiotherapy. If they don't do it, the physiotherapist does. They work together. And that leads me to this big study was done with 2 major hospitals, 2 400-bed hospitals. This is in court. This is an absolute truth. They had 2 hospitals that treated the same thing. One hospital, they had chiropractors and medical doctors and physiotherapists. The other hospital, they didn't have chiropractors. At the end of the 3-year study, the results came out. Where the chiropractors were, the average hospital stay was 7 days. But that doesn't mean anything until you compare it with the other hospital, and that was for 15 days. 15 days. This information was not released to the physiotherapists, the chiropractors, the medical doctors, which said chiropractors should be in every hospital.
Well, we don't have chiropractors in every hospital.
They should. They should. And the other biggest study that came out was low back and pregnant women in the 3rd trimester. Serious stuff. Okay, the MDs, Medical Association, decided they'd throw chiropractic in that.
So what you're trying to say is that there is help for those who have headache, and migraine, sinus, that if you go and see a chiropractor,
Yeah, they can
you
help
can
you.
be healed. What can be treated with vitamin C, doctor?
Oh God, man, we need 2 segments on that. But pregnant women, for instance, let me tell you about. Let me finish the pregnant women thing. They put the chiropractors in there, and the judge said, "You put chiropractors in because you hope they'd hurt these women." I'll get into vitamin C on pregnant women in a second.
Yeah.
Okay, and after the 3-year study, the results came back, and the results were when the chiropractors treated them, that was the only form of medicine or treatment that helped these women without any side effects. You know what the judge said? He said, "You kept this from your doctors when you knew you should be sending all your pregnant women with low back pain to the chiropractor? Because you were threatening your own doctor. You proved twice in this that you should be sending, but you're not letting them know this because you've told them you lose your license if you do." So vitamin C.
Yeah. Yes, Dr. Vitamin C, because I know there are a lot of people who might want to know what can be treated and could contact you later.
This is the tip of the iceberg, but vitamin C is a natural compound, okay? I talked about it. Everybody should watch episode 218 to find out about not chiropractic, but heart disease and vitamin C. You've got to watch that thing,
Yes.
okay? But pregnant women, now, in a fetus, the baby gets all the nutrients from the mother, okay? Including vitamin C for the development of the body. Well, the child's placenta has 2 times the amount of vitamin C as the mother. The umbilical cord has 2 times the amount of vitamin C, but the amniotic fluid has 3 times the amount of vitamin C. That little baby is sucking it out of that mother because it has to have it. Otherwise, you're going to have all kinds of problems. And if you, let's say, want to talk about vitamin C and non-communicable diseases like what does it do for, let's say, diabetes?
Right.
It's a subject that's big, but let me tell you one thing. Vitamin C looks just like blood sugar. 'Cause in animals, they make their own vitamin C. And what happens in humans, we lost that ability. But the receptors on the lining of the arteries are for glucose. Too much sugar, it takes too much glucose into the lining, and it swells up because too much glucose is toxic. You give them vitamin C, large doses, vitamin C looks kind of like glucose, and what happens is more vitamin C gets in that cell, neutralizes the toxicity, the swelling goes down, and the circulation increases to the
So
feet.
what are the other common diseases which people are facing here in Fiji can be treated with vitamin C?
Boy.
In a nutshell, just very quickly. So that after that they can definitely get in touch with you and and find out more.
Well, one world expert, this cardiologist that I've been studying for years, said that basically everything can be helped with vitamin C, and it's just the way it is.
Okay.
Now let me, if you can, just get into a little bit of what a chiropractor is, okay?
Yeah, sure. I was going to ask you, doctor, because definitely people might want to get in touch
Yeah.
with you. So what to expect during your visit to a chiropractor?
A lot of questions. Got to diagnose, analyze the problem, find out what it is. If you have x-rays, got to look at those. You have to ask them questions that is going to give you a clue as to what the problem is.
Yes.
Blood tests, urine tests, all those things give you clues to what's going on. And remember, chiropractic is a primary health care provider, like medical. And in the United States, they represented the GPs of natural medicine because everybody to practice natural medicine wanted to be able to practice under a government-approved license. So they went into chiropractic. And that's why the pharmaceutical people, if they knew that if you killed chiropractic, they cut off the head, you know.
So if people who are suffering from a migraine, headache, sinus, or a chronic lower back pain, and they want to get in touch with you, where do they contact you?
Well, just look it up in the phone book, okay? I mean, I don't do Facebook and all that, and people say, I didn't know you were there, and they've been here 10 years, and I said, why don't you look in the phone book? Come on.
All right. A last question, doctor. When we were preparing this program, I had this desire to have you and a medical practitioner together to discuss, so our audience at large benefits. but you wanted to be on this show on your own. Was there any reason to that?
Yeah, the medical doctor needs to hear those stories I just told because they're a fact, and he doesn't know anything about them because they were never told to any of the medical people. They suppress it from the international media. They control the media. Why would they want them to know that a woman went home and that was pregnant went home and took a pill because her back was so painful that her dad had, and her husband or somebody comes home and she's had a miscarriage because of the medicine she took innocently? What would the father say if he found out that the medical doctors had done the research to prove that every woman should be sent to the chiropractor?
So what you're trying to say is that painkillers, resorting to painkillers is a temporary treatment, whereas going to a chiropractor for chiropractic treatment is a permanent treatment?
Well, everybody can hurt themselves again, but more or less, yes. But when you have a pain from pregnancy, it's going to be temporary because you're going to deliver the child. The cause of the pain is going to go away, but the chiropractor can realign the spine and take the pressure off that woman so that she goes, wow, I don't even feel pregnant anymore because you feel so much better.
Thank you very much, Doctor, for coming on the show. I'd like to persuade the doctor one day so that we can get a chiropractor and a medical professional on the show together for a healthy debate, Doctor.
Yeah, well, it would be good. I'd like to talk to him about cancer and heart disease and diabetes.
We'll plan a talk together in near future.
We have to get people to catch up with what's really happening in the world.
Thank you very much, Doctor, for coming on the show. We'll take a break, and my last 3 segments, I'm going to talk to a medical professional on medical treatment, whereas Doctor mentioned about you don't need medicines or chemicals. So in the 3 segments, we're going to we're going to look at the other part of the story. So be with me and do call me on this talk back to join this discussion. Welcome back on Speak Your Mind. We had a very interesting session with the chiropractor, Dr. Byron Cragun, and I now have Dr. Emily Mataitonga, who's a consultant physician, and I have Dr. Karthik. Dr. Karthik specializes in abdominal problem, bowel cancer, and weight loss surgery, doctor. Welcome on the show. And just earlier you heard what Dr. Cragun had to say, so I wanted to pose the same question here, throw it to you now to tell me that our country has some good medical care, right? But sometimes the patients need maybe for a different type of therapy. Why don't more medical doctors refer their patients to a chiropractor if they can be helped?
Okay, do you want me to take the question?
Yes, both of you too.
Well, first, we practice modern medicine, and modern medicine is based on fact. Okay, and these facts are not just made by one person. It's done through a series of studies. Okay, so if someone comes in for cancer treatment, that treatment is standardized. It is based on a large number of patients having undergone several trials before this treatment is given to them. Okay, so our treatment is mainly scientific. We base our treatment on facts and not on fiction and not on hearsay.
So are you trying to say that chiropractors base their treatment on hearsay or fiction?
No, they may not, but their claim about being able to cure each and every disease under the sun, I think should be taken with a pinch of salt.
So what is the difference between a physician and a chiropractor? I know hospitals have physicians, but they don't have chiropractors.
A physician has to undergo 5 years of medical training, okay, and has to sit through a rigorous exam before they're allowed to pass their exams.
Right.
And then they're only a doctor. They neither are a GP nor a specialist nor even a physician. So they have to undergo further training before they can become either one of them.
Okay.
So that itself, and that in order to gain access to medical school, students have to learn a lot and they have to be top of their class. So it's not you can become a physician. To be honest, I don't know what the training chiropractors undergo, so I can't really say that. I can only say that what we do. And all modern medicine is based on science and fact. And the fact that naturopathy by itself means natural is not absolutely true. Do you can you eat like spinach without cooking it? So you do cook spinach because you can't just eat it raw. It's the same with modern medicine.
Okay.
Most of our antibiotics come from plants,
Yes.
and they are refined in a way.
Mhm.
You understand? So
Yes.
modern medicine is refined medicine.
So when someone has a lower back pain, then what would be a temporary fix, and what would be a permanent fix
Well,
here?
that is, first you need to find out what is the cause of the pain.
Mhm.
So, before finding out the cause of the pain, you cannot treat it.
Yeah.
So those who is treating it without finding the cause of the pain is actually not doing justice to the patient.
Yes. Well,
Because-
Dr. Cragun, because he's been in practice for many years, and he mentioned a few things about chiropractic and what is who is a chiropractor and chiropractic treatment for migraine and headaches and sinus. Do you think people should resort to chiropractic treatment only when it comes to migraine or headache, or should they go and see a doctor as well?
Well,
Emily?
ideally, you have a problem, you get it diagnosed, and
Yes.
it's in the process of diagnosing, you know what is the cause.
Yeah.
I'm not sure about the chiropractor mode of diagnostics and how they basically classify their diseases, but it'll be advisable, get a headache, see a doctor. Get it diagnosed with
Get some kind
conventional
of
medicine.
reports, right?
Exactly, conventional medicine where we can do investigations.
Yes.
We don't know what are their modes of investigations. And just to answer your question on why we don't refer locally,
Yes.
well, first of all, they are not recognized as an accredited within the accredited medical institution. So they're not part of a body which we're familiar with and we know how things are done. And so that's basically why we do not refer to them. We have our physiotherapists. And I couldn't say that they're the equivalent, but we really don't know their mode of practice, their training. We don't know how they do diagnostics. So it's safer for us to refer to those that practice conventional medicine.
Dr. Emily, you deal a lot with infectious disease. You talk a lot about that, and you see a lot of patients. So what are some common infectious diseases? Moving on from chiropractic, now let's talk about all this.
In our setting in Fiji?
Yes.
Well, from common colds to the basic ones that are the infectious diseases out in the community, like leptospirosis, dengue fever. Then you have your simple ones like hookworm infestations. It's a wide range. Infectious diseases actually encompasses having a sort of a combination of illnesses out of organisms in the community that are bacteria, virus, fungus, helminths, and protozoas. So it's a group of organisms that can cause illnesses. Yeah.
So while we talked about treatment by a chiropractor, there are some who resort to traditional medicines when it comes to all these things. What is your advice on that? Is traditional medicine good?
Okay, I actually won't say which is good and which is bad, but what I'd say is conventional medicine, in terms of treatment of infectious disease, is a proven thing. And the other thing is, when you do get an infection, by all means, you've got to identify what is a causative organism, and that includes tests. That's where doctors come in. They basically investigate the illness. So they've got to define, because organisms are different types right across the whole spectrum.
Yes.
They've got to define whether it's a bacteria, is it a virus, which is a common cold, a bacteria, or is it a simple worm infestations? That's where doctors come in. They got to diagnose that illness, because then they're going to treat it tailored to whatever the causative organism is. So if you're just basically treating blindly and shooting, you're basically creating more damage than good.
Can I add something?
Please.
Shami, what do you think is the most, what has caused, our population to grow older, and what has reduced the most number of deaths in the world? What do you think is, can I ask you a question?
Maybe
Just for-
ignorance.
No, what has increased the age, in the sense the longevity of people living now in the world compared to the last 19th century?
I wouldn't be able to answer
Vaccines.
that question. Yes.
Vaccines. And, vaccines are the most important, invention that was invented in the 19th century.
Medication and
Yeah.
vaccines both.
And they are based on fact. They are based on scientific data. Would you not get vaccinated? Would a child not get vaccinated nowadays? If we had people
To be,
dying,
because I
scores
know
of
that it
people-
is compulsory for children
Yeah.
to get vaccinated at certain
we had
ages,
scores
right?
of people dying of smallpox, dying of cholera, dying
Polio.
of TB, polio. And why has it happened? Modern medicine.
Which I think
That's
is
vaccines.
compulsory.
Yes,
which
it's
is
part of
compulsory.
infectious.
Yes.
It's part of
Yeah.
treatment in infectious diseases. Preventions of infectious diseases. One of the modes is vaccines.
Very definitely, and I know
And that's
that.
conventional medicine.
Yes, that's conventional medicine, and it is compulsory. That's why we have our medical team going to schools to make sure that they are
I would
vaccinated?
be very interested to know if such an alternative, treatment in either chiropractic or naturopathy is there. And if it is, then I'd be very interested in looking into it.
Thank you. These kinds of discussions are very healthy and very educational for audience at large who are listening and who are seeing us on this Talkback show to know, so they could make a profound decision. We'll take a break, doctor, and we'd like to talk about abdominal problems, bowel cancer, and I know a lot of people are interested in weight loss surgery. We'll see if we have time. We'll talk about this too. But quite interesting discussion. If you want to join me, do call me after this break on 322-0906 or 322-0907. Welcome back on Speak Your Mind, and I have with me Dr. Karthik and Dr. Emily Metai-Tonga. We've just, in the first two segments and the third one, we discussed about conventional medicine, then to the other type of medicine, right? We gave fair chance and fair platform to both doctors. So it is very important to get yourself diagnosed to know what is happening inside your body, because a human eye cannot see, right? So it's on practicing safe measures. So Dr. Karthik, you are originally from India, right?
Yes.
And you deal with abdominal pain, bowel cancer and everything. So tell me about what are the signs and symptoms of bowel cancer? How would anyone know that they're suffering from it?
Unfortunately, bowel cancer is silent most of the time. Bowel cancer depends on where the cancer originates from in the bowel. It can be from the stomach, or it can be from the colon and the rectum. Actually, looking through the health ministry statistics, the stomach cancer is the 4th commonest cancer in men in Fiji, and the colon and rectum cancer the 5th one. So actually, it's quite common in Fiji. So if people who do have stomach cancer, what they generally tend to have is they tend to have a feeling of feeling full at a very early stage after eating, and they may start to feel very tired because they're anemic, because they lose blood, and in addition they can have abdominal pain. Now these symptoms, as you know, can be attributed to a lot of people, because a lot of people come under these symptoms. They say, I got abdominal pain and I got some heartburn, reflux. Now the way to sort of segregate these people is depends on the age. Suppose if they're older, if they're above 40, 45 to 50, obviously the risk of getting cancer is higher. If they're a smoker or if they're a chronic alcoholic, so you got to go into the history to find out what constitutes. So you got to stratify their risk. So if their risk is higher, then you investigate them. Okay, but if they're younger and their risk is lower, then you treat them with medication. That's how we work.
You mentioned that if there is blood, if they notice blood, so does it mean that if someone has blood in their stool, they have bowel cancer?
No, not necessarily. There's the most commonest thing for that is hemorrhoids. Okay, but usually with hemorrhoids, bleeding is sort of bright red, and they usually have some pain or discomfort associated with it. Okay.
You mentioned that most people in Fiji have stomach cancer.
Not most people. It's the 4th commonest cancer in men, not in women.
What causes that?
Well, it's a combination of things. It can be either due to excess smoking, it's genetic, and also increased consumption of alcohol. And nowadays we attribute it to a bug called Helicobacter pylori, which increases the incidence. It does not actually cause it, but it creates an environment favorable that may cause cancer. Okay, it does not mean that if you have Helicobacter pylori you will have cancer, but it's better to treat it if you have it.
So how serious is this cancer?
Stomach cancer by itself is a serious problem, because unfortunately, despite recent advances in surgery and in radiotherapy, the 5-year survival after having treatment for stomach cancer, it's only in the region of 20%.
So survival rate is pretty low.
Yeah, pretty poor.
So Dr. Emily, does it get infectious at any time?
Interestingly, you asked, because there are certain infectious bugs that can cause cancers. One is, as you said, H. pylori. Pylori causing gastric cancers. You have the hepatitis group that can cause liver cancer. Then you have, what am I missing out? HPV and cervical cancer. And then once you have the actual progression of that cancer, it can get infective when they start, the tissues start getting sort of necrotic. That's when they are a good medium for harboring infections. So sometimes they do treat cancers with an exacerbation of an infectious disease. So antibiotics also can be part of the cancer treatment.
So when should one go to the doctor to find out about this?
When you have persisting symptoms, or when you have alarming symptoms such as weight loss, despite able to eat well or not able to eat at all, or feeling unusually tired, significant weight loss in a very short span of time. So these are the alarm signs.
So is the bowel cancer somehow linked to the abdominal pain in any case, or it's a totally different?
Unfortunately, pain is a late stage in most forms of cancer. Okay, cancer is usually what we call as insidious. It means it's a silent onset. Okay, so in most Western countries there is a screening program. Like in Japan, there is a screening program for stomach cancer because they have a very high incidence of stomach cancer. So they do an endoscopy whereby we pass a camera through the mouth and look inside the stomach. In the United Kingdom, if you look at it, they have a screening test for bowel cancer, which is colon cancer. So you can do either a stool test, which will tell you whether you got blood in your stool, and if you have a blood, then you do a camera test for your back passage, which is called a colonoscopy.
So do a lot of people come to hospital complaining about abdominal pain here in Fiji?
Yes, it's one of the commonest things that brings people to hospital, abdominal pain of all natures. So they come around, and that's when we start our investigative process. Sometimes it's pretty straightforward. It's just a diarrhea. I mean, a diarrhea is not just a diarrhea. Diarrhea has a causative agent.
Yes.
But yeah, definitely, it's one of the common presentations to hospital.
So when we talk about abdominal pain, where is this pain?
The pain depends on the site of the cancer. Okay, so if you have stomach cancer, it's just located around where we call the epigastrium, which is just underneath your breastbone. Or if you have bowel cancer, it can be either on your left side or sometimes on your right side of your tummy.
So can we categorize abdominal pain in a less serious cause or a more serious
of course.
cause?
You do have infectious causes for abdominal pain. The simple gastroenteritis. You have other causes such as appendicitis, which can give you pain. Even a urinary tract infection, urine infection can give you pain. So there are simple causes for the pain, but you have to see a doctor to know that.
Okay.
Sorry, can I just say
Yeah,
something
sure.
to that effect? Like abdominal pains, you talk about the intensity, location, and there are different types that they present themselves. You have the colic, the squeezing ones, just the dull ache. So those are the kinds of things we use in terms of trying to identify, first of all, the location of it, and basically work towards what it is.
Is it also linked to gastritis?
It can be linked to gastritis. Unfortunately, gastritis is a very common problem.
Yes.
And generally, most doctors or physicians or surgeons who see them, we give them treatment first, see whether they respond to the treatment. If they don't respond to the treatment, then we investigate.
Okay, we'll take a break, and when we come back, we'd like to talk about a little bit more on gastritis problem and weight loss surgery, which is currently being offered at Miyot Private Hospital. So I think that's a very interesting subject, and you'd like to know more about this. So stay with me on Speak Your Mind. Welcome back on Speak Your Mind. I'm your host, Shabi Lochanlal, and I have Dr. Emily Matai Tonga and Dr. Karthik from Miyot Private Hospital here in Suva. So, doctor, how many patients do you get who come to you and they tell you that they have gastritis? And is it a diagnosed gastritis, or because someone has told them they think they have gastritis? Because this is a common thing in Fiji.
Yes, it is a common thing, and I'm not sure what the diagnosis is based on, but they seem to think that they got gastritis. Gastritis means inflammation of the stomach. That means inflammation of the lining of the stomach. That means the lining of the stomach gets red in response to various things. Okay, so it can be due to excess alcohol, smoking, or due to increased acid production. Okay. Now, all this can contribute to gastritis. Now, gastritis, the patients may have several symptoms because of that. One, it can be due to abdominal pain, which is located under the breastbone. They may also get sort of heartburn and reflux, which Dr. Emi will be able to sort of...
So is it for sure that if someone does get heartburn or reflux, is it for sure that that person has gastritis?
No, that's got to be an ascertained diagnosis, and that's where you basically do the by exclusion diagnosis. Yeah. First and foremost, in our setting in Fiji, when a 35 to 45-year-old presents, whether it's a male or female, the first thing you got to be sure it's not the heart, because sometimes it's an atypical presentation for a heart problem, and sometimes it's what you got to exclude first before you go down the line, and that's where history comes in.
Okay.
When history comes in, then you can basically tease out which is just the inflammation, which is actually acid reflux, and which is something else sitting in there.
All right. We've got a caller online who'd like to put your headphones so we can hear this person. Hello. Hi. Welcome on Speak Your Mind. Your name and where are you calling from? Hello. Hi. You're on Speak Your Mind. Anyway, just a second. Welcome on Speak Your Mind. Your name and where are you calling from?
Hello, my name is Rishi Gunn. I'm calling from Telugu.
Yes, Rishi. You're on Speak Your Mind. Your question, please.
I've just been listening to this very interesting program from Mr. Byron, and now you expressed from the Super Hospital. Yes.
Yeah.
I'd just like to verify a fact. This doctor said that people in this country we are having longer lives now.
Yeah.
I seem to disagree with this fact because if you look on Fiji, people used to live longer, and now they're dying far younger. So where did you get this from?
Okay. Thank you very much for your question. So, Doctor, where was your...
The statistics of the, around the world just shows that the population across the world have been living longer. And that's not only in Fiji. And this is based on the World Health Organization statistics.
And we're talking about vaccination. It's because of vaccination.
It's because of vaccination.
Okay.
Yeah.
If there was no vaccination, then lifespan would be shorter. That's what we're trying to explain. Yes. Okay, let's go back to gastritis. We were talking about gastritis because what I have noticed too, that often when patients do go to see doctors and they complain of pain or some kind of severe burn, they're told, you have gastritis and there's no diagnosis. Do you think this is what the patients should, they should feel satisfied with this, or should they ask more questions?
No, most doctors would, if the patient's symptoms do not settle, offer them an endoscopy. But the problem with that is patients sometimes are not willing to undergo these investigations because they feel it's invasive. So generally the most common approach will be to give them some medication that will treat their gastritis and see whether they settle. And if they don't settle, then we offer them investigations.
So would it be dangerous to give a patient medicine to treat gastritis when it has not been diagnosed?
Well, it's not dangerous because the medication by itself is not dangerous. It has been proven through a lot of studies that it's a very safe medication which has been used for more than 20 years across the world population, and there are no significant side effects with it.
Okay. So what can one do to avoid gastritis? How can we
drink
overcome?
less? Do not
Alcohol?
smoke.
Yes.
Okay, and try and avoid stress and lead a healthy lifestyle.
Is it true that when we don't eat on time, it leads to gastritis as well?
Yes, it does. Yeah, we because your body is basically following a program, diurnal program, that where you basically, it's time to eat, you start releasing acid, and especially so if you've had a standard program sort of life, you've had breakfast, lunch, and dinner in between these times. What do you call that symbol? Pavlov's?
It's a Pavlov's response.
Yeah, it's a Pavlov's response. Your acids will start secreting at the time when your body knows you're supposed to be eating. And those are the dangerous factors which actually can affect your stomach lining.
Okay. So if it is gastritis, does it have to do with trapped gas in the body as well?
No, that is a different phenomenon. Yeah, it is possibly it contributes to it, but it is mainly where they have increased. They may have aerophagia. Some people swallow air when they eat, and some people drink a lot of fizzy juices. Some people might eat food, that might produce a lot of gas inside the bowel.
Okay.
So these are all things that contribute to it.
We had also promised that we were going to talk about weight loss surgery.
Yes.
Not a weight loss. This is not a weight loss program, right? People have to undergo surgery. Who are the people who need this?
Well, these are all people who have what we call a BMI with the body mass index over 40 or over 35 with a condition such as diabetes or high blood pressure.
These are people who cannot reduce their weight by exercise or by watching the diet.
These are people who have tried and failed to lose their weight.
Okay. Do we do that in Fiji, weight loss?
Well, we are going to offer that, but at the minute we are offering a program where we will be able to try and help them to lose weight on their own. If not, we can offer them bariatric surgery.
So how does one qualify for weight loss surgery?
For that, your body mass index needs to be more than either 35 with a medical condition such as diabetes or blood pressure, or your body mass index need to be more than 40.
So what happens in weight loss surgery? What kind of surgery is done?
Well, primarily there are two types of surgery, what we call as restrictive surgery or malabsorptive surgery. With the restrictive surgery, we commonly do what's called the sleeve gastrectomy, whereby we reduce the size of the stomach. Our normal capacity of the stomach is about 500 mils. So we reduce the size of the stomach by removing about 60% of the stomach, and we reduce it to about 100 mils. So that if you're able to, eat one bowl of rice, you'll be able to eat only 1/4 of it, and that makes you lose weight.
Good. And I think it will be something to control NCDs probably.
Oh, definitely. It helps you to control your diabetes much better, and I got patients who have been cured of their diabetes because of this.
That's great. Thank you very much. That's all we have. We don't have much time to discuss further. But
Before
yes.
we go, we would like to make a statement that
Sure.
modern medicine is practiced on fact,
Okay.
and is practiced on studies that have been done across the world, and that have been replicated in other places. I would like more of this naturopathy treatments to do the same, to publish their results, and also to see whether anyone else can replicate the results.
Yeah.
That will be the test of the natural medicine.
Thank you very much, Dr. Emily and Dr. Karthik. And I'd like to thank Dr. Cragun for being on the show, but it would be interesting to see both a chiropractor, physician, and a medical professional to come on the show to discuss this further and to have a good and a healthy debate on this topic.
We'll be
so
more
that-
than happy to do it.
Yes, so that the public at large, anyone who's listening and, will benefit. I think it is good. It's high time people know everything, I guess. Learning is a great process. So thank you very much for coming on the show, and I'm sure you must have enjoyed today's program. We have a wealth of information today, from chiropractic treatment to medicinal treatment to diagnosis. So do not fail to see your doctor if you have any kind of symptoms. It is very good. Say the prevention is better than cure. So go and see your doctor. I'll be on Speak Your Mind next week, Tuesday, on another interesting topic called cancer, which is found in adults. I'll be working with Fiji Cancer Society to bring this show to you, which is next Tuesday. So be sure to join me next Tuesday on Speak Your Mind, and to join the discussion, I encourage you to call me during the show. So see you next week. Thanks very much for being on the show.
Thank you.
Thank you.